Can Botox for OAB cause urinary retention? Imagine finding relief from frequent urges and leaks thanks to Botox, but then facing a new challenge of not being able to empty your bladder fully. That's a real possibility with Botox injections for overactive bladder. Botox, or onabotulinum toxin A, works by relaxing the bladder muscles, which helps reduce involuntary contractions that cause urgency and frequent urination. But this relaxation can sometimes go too far, making it harder for the bladder to contract properly. As a result, some people may experience urinary retention, which means they cannot empty their bladder completely or at all. Research shows that urinary retention after Botox treatment for overactive bladder happens in a small percentage of patients. Usually, about 6 to 11% of people may need temporary catheterization to help drain the bladder. The risk increases with higher doses of Botox, especially doses over 100 units, which can nearly double the chance of needing catheterization. Patients with higher baseline post-void residual volume, meaning they already have more urine left in the bladder after urinating, or men, especially those with prostate issues, are at greater risk. Most cases of urinary retention caused by Botox are temporary. Patients often need to perform clean intermittent self-catheterization for a few days or weeks until bladder function recovers. The duration varies but typically lasts from 2 to 6 weeks. Alongside retention, some might experience urinary tract infections, blood in the urine, or difficulty starting urination. These side effects are related to the muscle relaxation effect of Botox and, if necessary, the use of catheters. Healthcare providers carefully evaluate each patient before administering Botox for overactive bladder. They assess bladder emptying function and discuss the possibility of needing catheterization afterward. Patients are monitored closely after the injections to catch any signs of retention early. While the risk exists, it's important to remember that Botox can significantly improve quality of life by reducing symptoms like urgency, frequency, and incontinence. In the context of bladder health and bladder cancer, Botox is generally safe and does not increase cancer risk. However, any treatment that affects bladder function should be managed carefully, especially in patients with a history of bladder issues. Overall, if you are considering Botox for overactive bladder, talking openly with your healthcare provider about the benefits and potential risks, including urinary retention, is essential. This way, you can make an informed decision and have a plan in place for safe treatment and recovery.